Many people, including our group, have been interested in unraveling the components of the immune system that may be relevant for benefit of chemotherapy or chemotherapy along with targeted treatments. We have been evaluating genomic markers that may impact, but we decided to also evaluate whether the presence of lymphocytes or the amount of lymphocytes in the tumor specimens impacted outcome of therapy. So we utilized specimens from patients who participated in a well-known adjuvant trial called N9831, which enrolled many patients with HER2-positive early-stage breast cancer, where patients were treated with chemotherapy or chemotherapy Trastuzumab. So we have an opportunity not only that the patients were treated two different ways depending on their randomized arm, but also we have excellent tumor specimens collected along with long-term clinical follow-up. So in this context, we were able to take the tumor specimens, evaluate the tumor specimens for the percent infiltrate of lymphocytes, then correlate that with clinical outcome for the two groups of patients, those who received chemotherapy alone versus those who received chemotherapy in combination with Trastuzumab. As most people know around the world, actually, chemotherapy with Trastuzumab has become a standard of care based on results of our N9831 trial as well as others. But it's really important that we all work together to determine whether we can have some markers that help us determine who are the patients who do the best with Trastuzumab. Are there patients who do well with chemotherapy alone? And this study allows us to comment on these important issues. The way we did this study is that we had pathologists look at the tumor specimens, but the pathologists did not have any knowledge of the treatment arm of the patient or the outcome of the patients. So it's what we called a blinded study. Specifically for patients in arm A, which were the patients who received chemotherapy alone, there was a difference in patient outcome based on the lymphocytic infiltration within the tumor. If the tumors had very high lymphocytic infiltration, which we call lymphocyte predominant tumors, the patients did very well with chemotherapy, whereas they did not do as well if the tumors had low lymphocytic infiltration. In other words, lymphocytic infiltration was a prognostic marker if the patients received chemotherapy alone for early-stage HER2-positive breast cancer. Now the second group. And this was the group of patients who received chemotherapy in combination with Trastuzumab, which is the standard of care now. Well, we found that the degree of lymphocytic infiltration did not impact the benefit of adjuvant Trastuzumab. This is also very important because there had been a report from another group in Europe which had suggested that the degree of lymphocytic infiltration was actually a prognostic of benefit to Trastuzumab, and we actually dismissed that as being the truth, at least based on the results of our study. Implications for practice. We think we need to certainly validate these results in another study, which we plan to do. But for now, I think it's very intriguing that the degree of lymphocytic infiltration may be important for benefit of chemotherapy alone, because if a study corroborating these findings is done, we may decide, well, if a patient has a very high lymphocytic infiltration, perhaps they don't need Trastuzumab for a year. And this could be tremendously important from the patient standpoint, certainly from the economic standpoint. At the same time, the standard of care today is chemotherapy Trastuzumab, and we still feel that that is the standard of care for most patients until we have additional studies telling otherwise. But for those patients, we think that there is no need to incorporate the degree of lymphocytic infiltration to make that decision. We believe, based on the rigorous nature of our study, that our results are really relevant to the understanding of the impact of lymphocytes on benefit of adjuvant Trastuzumab in patients with early-stage HER2-positive breast cancer.